All right, welcome back. So now we're starting our discussion of another endocrine gland. This is going to be the thyroid gland. Thyroid gland is releasing three different hormones. Those are the thyroxine, T4, thyroxine or T4. Then we've got here the T3, triiodothyronine, and the fourth hormone it's the calcitonin. T3 and T4, or the thyroxine and the triiodothyronine, those are going to be considered the thyroid hormones. Those are the major metabolic hormones. They will enhance the metabolic rate, means they will boost all the metabolic reactions. Also, they will generate heat. They are responsible for heat production. That's why we consider them calorigenic hormones. What I mean by calorigenic hormones, they will be breaking down the fat, they are breaking down the carbs and will be releasing heat from those from those uh, stored forms of energy. The T3 and T4 are going to be playing a role in maintaining a normal blood pressure. So if I have a decline in the thyroid hormone release, I will have a decrease in my blood pressure. Also, they play a major role in tissue growth because in order for a tissue to grow, it needs to perform its own metabolic reactions. And those metabolic reactions are going to be mediated and enhanced by the thyroid hormones. It's required for normal development of the skeleton and the nervous system. And this explains why if a person has a drop in the thyroid hormone levels, especially in younger age, children, they will have short stature, they will have similar to the dwarfs, but they also, on top of it, they might develop mental retardation because of the lack of development in the nervous system. Also, having deficiency of the thyroid hormone gonna alter the reproductive capabilities, and those patients might have infertility if they got hyposecretion of the thyroid hormones at younger age. So if you see on here, this is my thyroid gland, this butterfly-shaped gland located anterior to the trachea in the lower anterior aspect of the neck. If I look at the microscopic structure, I will see that I have follicles, and those follicles contain the colloid material. This is the thyroid hormone, T3 and T4. And the cells here forming those follicles are called the follicular cells. And between the follicles, I've got clusters of cells on here. Those are called the parafollicular cells, the cells close to the follicles or next to the follicles. The parafollicular cells are going to be the ones responsible for the release of the calcitonin. And the calcitonin here is going to be responsible for reducing the blood calcium level. And this is going to be the antagonist action of the PTH. PTH is going to be responsible to increase the blood calcium levels. The PTH is going to be released from four tiny glands located on the dorsal aspect of the thyroid gland. We call the main function of PTH, it's going to be to maintain the homeostasis of the calcium by increasing the blood calcium level in case of low blood calcium. So if I have low blood calcium levels, calcium is highly important for normal electrical conduction in the nervous system, for you to be able to contract your muscles, including your skeletal and cardiac muscles. So it's very important to maintain a normal blood calcium level. So in case of a drop in my blood calcium levels, I need to increase it back to normal as soon as possible. So the hormone here that will be acting to increase the blood calcium level, it's the PTH, or the parathyroid hormone. It increases the blood calcium level by three means. First, by activating the digestive cells located within the bones. And if you remember, the bone eating cells, those are the osteoclasts. So PTH enhances the osteoclasts to break down the protein within the bone. And as you break down the protein within the bone, this gonna allow the calcium to be freed, and it will, rather than remaining in the bone, it's gonna go to the blood, increasing the blood calcium level. Another function of PTH is by acting on the kidney to activate vitamin D. And when I activate vitamin D, vitamin D is essential for normal absorption of the calcium that I'm eating from the small intestine. So if I'm eating food with high calcium and I don't have vitamin D, this calcium won't be able to get absorbed into my bloodstream. So in order for it to be absorbed, it needs to have activated vitamin D to allow its absorption. And the PTH here is activating vitamin D in the kidney, and this gonna be allowing the calcium to travel from your small intestine to your blood, and this is gonna increase your blood calcium level back to normal. Another main action by which PTH is increasing the blood calcium level is by stimulating the kidney tubules to absorb the calcium that is about to get released out in the urine. So this is my nephron. This is the functional unit of the kidney. If I got some calcium that is about to get released out in the urine, this calcium is going to be reabsorbed back into my blood vessels to maintain a normal blood calcium level. So three main actions here of PTH to increase the blood calcium level in case of reduction in the blood calcium. We've got bone resorption. What I mean by bone resorption is a bone breakdown, and bone resorption is going to be taking place under the effect of the activated osteoclasts that will break down the osteoid material that is holding the calcium in the bone. Second action is by activating vitamin D, allowing the absorption of the calcium from the small intestine. And if any calcium got filtered out and it's on its way to be released in the urine, I will recapture this calcium and will reabsorb it back into my blood to increase my blood calcium level. So three main actions here of PTH. First one is the resorption of the bone, breaking down of the bone to release the calcium. Second one is the absorption of the calcium in the food that we're eating by activating vitamin D. And the third action here of the PTH is by enhancing the calcium reabsorption from the kidney tubules. And this calcium was about to get released out in the urine. So if we go back to the calcitonin, calcitonin is the antagonist hormone for PTH. It opposes the action of PTH. PTH is trying to increase the blood calcium level. On the other hand, calcitonin is going to be reducing the blood calcium level. How does it reduce the blood calcium level? First action of the calcitonin is by inhibiting the action of the osteoclast. I'm preventing the osteoclast from breaking down any further bone. Another action is going to be by enhancing the incorporation of the calcium in the bone. So here, if I have high calcium level in the blood, the calcitonin action will be to enhance the bones to uptake this calcium and incorporate it with the osteoid. So as a result, this is going to be reducing the blood calcium level back down. So it's a matter of balance here. So you don't want to have only an increase in the blood calcium level. You don't want to have a reduction in the blood calcium level. You want to maintain the blood calcium level at normal levels. All right, so that's why we've got two opposing hormones acting in two different ways to maintain a normal blood calcium level. This is where the parathyroid glands are located. They are located on the dorsal aspect of the thyroid gland, as you see on. Moving on to another gland, this is going to be the suprarenal gland or the adrenal gland. The adrenal gland is this pyramidal shaped gland located above the kidney. As we mentioned earlier, it has two different parts. The inner part of the adrenal gland, this is my adrenal medulla. And the outer part of the adrenal gland, this is going to be the adrenal cortex. The adrenal medulla, it's going to be stimulated by the sympathetic nervous system, and it's going to be responsible to release the adrenaline or the epinephrine and norepinephrine. And the main function of the epinephrine and norepinephrine is to boost the sympathetic action. So what is the sympathetic action? It's going to be increasing my heart rate, it's going to be increasing my blood pressure, it's going to be increasing my blood sugar level. All those going to be boosted by the epinephrine and norepinephrine released from the adrenal gland. So main functions of the adrenaline or the epinephrine and norepinephrine is to increase the blood sugar level, increase the blood pressure by constricting the arterioles, by constricting the blood vessels, the same way like ADH did act, increase the heart rate, and it will be responsible to divert the blood from going to your gastrointestinal tract, for example, to be directed towards your brain, your skeletal muscles, and the heart. So all this is going to be effects of the epinephrine and norepinephrine that boost the sympathetic activity in case of fight or flight or during stress. Moving on to the adrenal cortex. The adrenal cortex is formed of three different layers. From outside in, we've got outside zona glomerulosa. Then deeper to it, we've got the zona fasciculata. And then we've got the zona reticularis. So in order to remember, we put those from outside in, GFR. GFR is a very famous medical abbreviation that stands for glomerular filtration rate, but we use it here as a mnemonic to remind us of the order of the different layers. So again, from outside in, the adrenal cortex is formed by zona glomerulosa. Outside, then deeper to it, we've got the zona fasciculata. And then the deepest layer of the adrenal cortex is going to be the zona reticularis. What's going to be produced from all those three zones? From the zona glomerulosa, we're going to be releasing a set of hormones called the mineralocorticoids. From their name, mineralo, I am dealing with minerals, or in other words, ions. And corticoids, those are released from the cortex. From the zona fasciculata, we're releasing another set of cortical hormones. Those are my glucocorticoids. And from the name on here of the glucocorticoids, those are mostly concerned with glucose. They are going to be increasing the blood sugar level. And the deepest layer of the adrenal cortex is going to be responsible to release another set of hormones. Those are going to be the gonadocorticoids. And from the name on here, they are similar to the hormones released from the gonads, means they are releasing sex hormones. The most famous mineralocorticoid that gets released from the zona glomerulosa, this is going to be my aldosterone. And the aldosterone main function is to retain salt, retain the sodium from being released out in the urine. So what do you think is going to be the effect of the aldosterone on your blood pressure? If it retains the sodium, it enhances the sodium reabsorption. What do you think is going to be the effect on your blood pressure? If a person has hypertension, would you ask him to eat more or less sodium or salt? What do you think? You ask him to eat less sodium. All right, so if I'm retaining the sodium, means what? Means this sodium gonna be pulling water with it by osmosis. And as I retain the sodium inside my blood vessels, what's gonna happen? My blood volume gonna expand, and this increases my blood pressure. So here the aldosterone is concerned with the sodium reabsorption, salt. That's why we called it mineralocorticoid. Next zone is going to be the zona fasciculata. And the zona fasciculata, as we mentioned, is going to be producing the glucocorticoids. And the famous glucocorticoid is cortisol. And from the name here, glucocorticoids are going to be responsible to increase the blood sugar level, increase the glucose. levels in the blood. What other functions do you know of the cortisol? Why do you use cortisol as a treatment? Did you ever go and get hydrocortisol cream or ointment from the pharmacy? What do you use the cortisol for? Itching, right? To reduce inflammation. So the main function here of the cortisol in terms of immunity, it's the reduction of inflammation. Actually, we classify the anti-inflammatory medication either NSAIDs or not. NSAIDs mean non-steroidal anti-inflammatory medication. So NSAIDs means they are not steroids, they are not cortisol or one of its derivatives. So a big part of the anti-inflammatory medications are going to be cortisol or glucocorticoid derivatives. All right. So cortisol is going to be responsible to suppress the immune system, suppress inflammation. Another function of the glucocorticoid also is going to be to constrict the blood vessels, and this is going to be increasing my blood pressure. So what are the three main functions on here for the cortisol? Again, looking at cortisol and his brothers, cortisone, corticosterone. They increase the blood pressure, they increase the blood sugar level, and they reduce the immunity. And this explains why, in case of stress, a person might get an infection. So, for example, if a person lost a loved one or a person did break up with his girlfriend or her boyfriend. So in some cases, you will see patients are coming with very coming into the clinic very sick, and the underlying cause is not very known. It might be a viral infection of some kind. So what happened in here, because of the stress, we release a stress hormone, and the stress hormones are the cortisol, cortisol, and corticosterone. Those are our famous stress hormones. And in response to the stress, your body releases cortisol in order to increase the blood sugar level to cope with the stress, because in case of stress, you're going to need more glucose in the blood to think, to act, increase the blood pressure to deliver more blood to your organs. In case of stress, you want to respond. But at the same time, we're also going to be suppressing the immune system, suppressing inflammation, and so on. So by the suppression of the immune system, some people might, in case of stress, get sick just because of the rise of the cortisol, and their immune system was not able to get rid of the infection as it should be normal. The third layer of the adrenal cortex is going to be the zona reticularis, and it's going to be releasing gonadocorticoids, and those are sex hormones. Male androgens, male sex hormones that are getting released in both males and females. The androgen, if in a male person, it gets converted into a more potent form, the testosterone in the cells, and or it gets converted in females into estrogen. So we're going to be releasing male sex hormone first from the adrenal cortex, from the zona reticularis, and according to the sex of the person, it gets either converted into testosterone in males or estrogens in females. Why do you need to have sex hormones released from somewhere else other than the gonads? Didn't we mention that the gonads are going to be responsible for the production of the sex hormones? Yes, but before puberty, we didn't have the gonads producing those sex hormones. They will get activated during the time of puberty. So before that, we rely on the gonadocorticoids released from the adrenal cortex. And those will play a very important role in the onset of puberty and the appearance of the secondary sex characteristics, like in females, the fat distribution, the development of the breast, the voice, the hair, also in males, the facial hair, pubic hair, deepening of the voice, increasing the muscle bulk, increasing uh, in the density of the bones. All those are secondary sex characteristics due to the presence of the sex hormones in either sex. Also, they play a very important role in the sex drive. So looking at the gonadocorticoids on here, those are the androgens. And again, those androgens are either going to be transformed into a more potent form in males, testosterone, or the female sex hormone, the estrogen. So looking here, those are the sex hormones. So in order for us to remember which hormone is released from which layer, I know this is confusing. So again, we give a mnemonic here. We use the mnemonic GFR to remember the order of those layers. Zona glomerulosa from outside in, fasciculata, and then reticularis. And GFR stands for the glomerular filtration rate. It's a very known medical abbreviation. And in order to remember here, the different hormones released from the layers. So remember, outside is related to salt. This is the aldosterone that enhances the sodium reabsorption. Next layer is going to be related to the sugar, glucocorticoids, which are responsible to increase the blood sugar level, like the cortisol, cortisone, and corticosterone. And the third layer is related to the sex hormones, sex drive, onset of puberty. It's the gonadocorticoids. So remember, here's a mnemonic to remember this. It says, the deeper you go, the sweeter it gets. All right? So this is just for you to remember what hormone is released from which layer. All right, so from outside, salt, sugar, and then sex hormone. All right, so this completes our discussion here of the adrenal cortex. Again, adrenal gland is going to be formed of two main parts, adrenal medulla and adrenal cortex. Adrenal medulla is going to be activated by the sympathetic nervous system, and its action is to boost its effect by releasing epinephrine and norepinephrine. The adrenal cortex, the outer part of the adrenal gland, GFR, glomerulosa fasciculata reticularis, they are releasing mineralocorticoids, glucocorticoids, and finally gonadocorticoids. All right, so how the adrenal gland is going to be responding to stress. So all the adrenal gland parts going to be activated to respond to stress. So the adrenal gland, adrenal medulla, and adrenal cortex are both going to be stimulated. So in case of stress, you're going to be releasing from the adrenal medulla the epinephrine and norepinephrine, the catecholamines, which will be boosting the sympathetic activity, Look in here, they are increasing the heart rate, increasing the blood pressure, increasing the blood sugar level, dilating the bronchioles for me to be able to breathe easier, to get more air from outside. And I will be decreasing the digestive tract motility, inhibiting elimination, including defecation and micturition, and I will be boosting the metabolic rate. Also, in the same time, your adrenal cortex is going to be releasing its hormones, mainly the glucocorticoids and the mineralocorticoids. Remember, glucocorticoids are like the cortisol, cortisone, and corticosterone, and mineralocorticoids like the aldosterone. So what was the action of the aldosterone, if you remind me, please? Is retention of the sodium. And when you retain sodium, what's going to happen to the water? Water also going to be retained. And when I retain the water in the blood, it didn't get released out in the urine. What's going to happen? This increases my blood volume. And when I increase the volume, the blood pressure goes up. So you see on here, blood pressure is going to be increased by the mineralocorticoids and the catecholamines. Catecholamines are also increasing my blood pressure. Also, in response to stress, the adrenal cortex is going to be releasing the glucocorticoids, which will be enhancing the breakdown of proteins and fat to increase the blood sugar level. And that's why you will see people who are treated for long years with cortisol, they will have weaker bones, defects in the collagen of the skin. See on here, this is before having a lot of cortisol. This is after being exposed to high level of cortisol. So this is a patient with Cushing's syndrome. Cushing's syndrome is the disease where I have increase in the cortisol levels. All right, you see on here, I break down, cortisol is simply breaking down everything to increase your blood sugar level. You are in case of stress. I don't want bones, I don't want muscles. All right, so according to the reason. So if the reason is because of a long-term medication, we need to balance the benefits compared to the complications. So if a person has an autoimmune disease, for example, that causes the defects in his joints, like rheumatoid arthritis that we've discussed before, if you remember. So I will be using cortisol as a treatment. So I need to balance the benefits compared to the complications that the patient is suffering from. But in case of Cushing syndrome here, yes, I can treat the disease, but as far as the complications, they will be some kind permanent. So you can reduce the effect, but never gonna be normal again, because it requires a lot of effort to do it. All right. So because you're breaking down everything and it takes time to rebuild everything back again if the initial disease was cured. All right, so what I see on here, cortisol is breaking down everything, bones, muscles, skin, everything. To do what? To increase the glucose level. Do I need glucose in case of Cushing syndrome here? I don't need the glucose. I'm not in case of stress. I'm not in case of stress. So I don't need this glucose. So where is this glucose gonna go? It gets stored out in the form of fat. And one of the signs of this disease is gonna be the buffalo hump in here, which is a fat pad in the back of the neck. All right. I don't need this glucose, so all the extra glucose I'm building is simply going to be stored in the form of fat. So it can be iatrogenic, it's going to be, it might be a complication of long-term treatment of with cortisol, like in patients with autoimmune diseases, because one of the functions, if you remember, of cortisol is to suppress the immune system. And we give a lot of cortisol and its derivatives in case of organ transplant to prevent the rejection of the transplanted organ. All right, so again, glucocorticoid is going to be breaking down everything to convert it into glucose. This increases my blood sugar level, and at the same time, it suppresses my immune system. And this explains why here your adrenal gland responds to stress. It explains why people who live a very stressful life are more likely to develop hypertension and diabetes. They are more likely to develop hypertension and diabetes because of the release of those different hormones over long years. So if a person is living a very stressful life, he has a much higher chance of developing hypertension and diabetes. Moving on to another gland, it's the pineal gland. If you remember, this was a small gland hanging down from the roof of the third ventricle in the brain, in the diencephalon, and it was responsible to release melatonin. And the melatonin is going to be responsible for the sexual maturation and puberty. It's determining the timing for the puberty and sexual maturation. Also, is going to be responsible for the regulation of the day-night cycles and the other rhythmic variations like the body temperature, the sleep, the appetite, and so on. Moving on to another gland, it's the pancreas. And the pancreas, it's a combined gland. It has two parts. It has an exocrine part and an endocrine part. If you remember, what was the difference between an exocrine gland and an endocrine gland? Endocrine glands are ductless glands. They are releasing their secretions directly in the bloodstream. So those secretions, which are the hormones, those chemical messages, are going to be released directly to the bloodstream. Compared to the exocrine glands, they are going to have ducts, which will be conducting their secretions to the lumen of another organ. Okay, so those have ducts, those are ductless glands. So the pancreas actually has both parts. It has the acini or the acinar cells. Those are going to be producing the digestive enzymes that will be released in the small intestine to help break down the food. So those are considered the exocrine part, exo, outside. And I mean by outside here, outside of the blood. The endocrine part, you remember, those have the same name like the macrophage that we've seen back in the skin. Do you remember what was the name of the cells, immune cells that were located back in the skin chapter? I told you back in chapter 5. I will ask you later on when we reach chapter 16 about the name of those cells. Yeah, Langerhans cells, exactly. Langerhans cells. So the same guy on here also did discover the hormone releasing cells in the pancreas. Those are the islets of Langerhans. So we call them islets of Langerhans because they are present in clusters. And he already has called the other macrophages of the skin Langerhans cells. So we call those ones the islets of Langerhans or the pancreatic islets. The islets of Langerhans are going to be releasing two very, very important hormones. Those are the insulin and the glucagon. They are not the only two hormones, but they are the most important ones for us. The insulin, it's a hypoglycemic hormone. What I mean by hypo means low, glucose, emia, blood. Like anemia, low red blood cell count, low hemoglobin levels, low oxygen carrying capacity. Anemia simply means without blood. Emia means blood. All right, so hypoglycemic means it lowers the blood sugar levels. Hypoglycemic hormone. Compared to the glucagon is a hyperglycemic hormone. What I mean by hyper means it increases what? The blood sugar levels. So again, those two hormones that we're looking at today, those are the insulin. Insulin, it's a hypoglycemic hormone. It reduces the blood sugar level. Compared to the glucagon, it's a hyperglycemic hormone. It increases the blood sugar level. The major target organ for the glucagon, it's the liver. Glucagon acts on the liver to increase the blood sugar levels by stimulating the liver cells first to break down the stored glycogen into glucose. And this glucose, when it gets transported from the liver to the blood, it will increase the blood sugar level, causing that's why we consider it as a hyperglycemic hormone. The other function here of the glucagon, it acts on the liver cells to enhance it to convert the amino acids and the lipids into glucose. And this glucose, after you form it in the liver cells, it needs to be released from the liver to the blood. So those are the three main actions. It enhances the conversion or the breakdown of the glycogen into glucose. It enhances the conversion of the proteins and fats into glucose. And the third action on here is to enhance the release of this glucose from the liver into the blood. So what we call the chemical reactions that enhances the breakdown of the glycogen into glucose, we call this is my glycogen breakdown lysis or glycogenolysis. Glycogenolysis means the breakdown of the glycogen. What are you breaking down the glycogen to? You're breaking down the glycogen into glucose. Glycogenolysis. The conversion of amino acids, fats, and fats into glucose. This is what we call the gluconeogenesis. What is genesis means? Genesis means creation, formation. Neo means like neonate means newly born. Neo means new, and gluco means glucose. So this is a formation of a new glucose. What I mean, a new glucose, that this glucose that I'm forming, it's coming from a non-carbohydrate source. It was not carbohydrate before. So first action of the glucagon on the liver cells is to enhance glycogenolysis, the breakdown of the glycogen into glucose. Also, it is responsible for enhancing the gluconeogenesis, which is the formation of a glucose from a non-carbohydrate source, either from fats or proteins, or the intermediates of the fats and proteins. A third action will be to release this glucose that you got formed from the liver in the bloodstream. This is how the glucagon is increasing my blood glucose level. It's a hyperglycemic hormone. Insulin targets almost all the body organs, and its main function here is to allow the glucose to move from the blood into my cells, for the cells to utilize this glucose and use it as a source of energy. For the extra glucose that I have in the blood, at this point I won't need it to produce energy, so what will I do with it? I will convert it into its storage form by converting this glucose into fat or into glycogen. Insulin enhances the transport again here of the glucose into fat and muscle cells. Insulin is highly important in the normal neuronal development because your brain needs a lot of glucose to carry on its metabolic activities. It's also going to be playing a major role in learning and memory. In order for me to reduce the sugar levels in the blood, I will need also not only to get the glucose inside the cells, but also prevent the action of the glucagon. So it's going to be inhibiting the glycogenolysis and the gluconeogenesis. So you see on here, this is your normal blood sugar level at a balanced state. When I eat, what happens? My blood sugar level is going to be increasing. So the pancreas is going to be releasing insulin in response to this increase in the blood sugar. And this will enhance the fat cells, the muscle cells, the liver cells to uptake this glucose. This will reduce the blood sugar level back to normal. What if I'm starving? I didn't eat anything today. How am I able to function? My brain needs continuous supply of glucose. How would I increase this glucose if I didn't eat anything today and my blood sugar level is declining? So instead of increasing the release of insulin from the pancreas, you're going to be releasing glucagon, which is a hyperglycemic hormone. So glucagon will be targeting the liver cells, enhancing the glycogenolysis, the gluconeogenesis, and will be enhancing the release of the glucose into my bloodstream, increasing the blood sugar level again back to normal. So what we're looking at in here, we're looking at the effect of both hormones to maintain a normal homeostatic balance of my blood sugar level. All right, so again, insulin is reducing the blood sugar level. It's a hypoglycemic hormone. Glucagon is going to be increasing the blood sugar level. It's going to be a hyperglycemic hormone. Questions? All right, so let's answer some in-class activity questions for today. So our very first in-class activity question for today is, where does the growth hormone come from? Where do you release the growth hormone from? Hypothalamus, anterior pituitary gland, posterior pituitary gland, or adrenal glands? Which one is releasing your growth hormone? You remember? Remember here, growth hormone is the hormone that gets released from the adrenal hypophysis, my anterior pituitary gland. Anterior pituitary gland. The neurohypophysis is going to be releasing the oxytocin and ADH. Neurohypophysis is going to be the one that will be releasing the ADH and oxytocin. So where do I get the growth hormone again from? It's from the anterior pituitary gland. Anterior pituitary gland. All right, so what does oxytocin do? Is it milk production, milk ejection, uterine contractions? Which one is a function of the oxytocin? Do I allow milk production? Do I allow milk production? Yes or no? Remember which one is responsible for production is the one called prolactin, right? So it's not responsible for production. Am I doing anything related to milk ejection? Yes, remember the oxytocin was contracting the lactiferous sinuses, allowing the milk ejection or milk letdown. Yes. Do I play any role in the uterine contractions? Yes, during labor, oxytocin is increasing the uterine contractions, allowing labor to take place. So here, the good answer is going to be B and C, which is going to be, all right, both B and C. Both B and C. So I'm responsible for milk ejection and I'm responsible for the uterine contractions. This is going to be our second question for the in-class activity for this session. Our third question for the in-class activity for this session today, it's going to be what hormones hormone or hormones is or required for milk production and milk release. Production and release. Production, I need prolactin. Release, I need oxytocin. Thyroid stimulating hormone, do I need it for milk production ejection? No. FSH, if you remember, FSH was responsible to enhance the ovaries to produce the gametes to form the sperms and the eggs. So I'm not going to be playing a fundamental role in here in the milk production and milk ejection as FSH. All right, so what is a good answer on here? It's B and D. B and D. This is going to be letter G.